testive strategy. Now, who may be tested? Number one, symptomatic individuals. So all symptomatic individuals in the community need be tested. All symptomatic individuals. All high-risk contacts of laboratory confirmed cases. All high-risk contacts. Now, what are those high-risk contacts? Elderly more than 60, comorbidities, diabetes, hypertension, lung disease, kidney disease, cancers, obesity. So this, all high-risk contacts need to be tested in a community. And then we are talking about international travel, and we will not talk, that is already mentioned. Then who may be tested in a hospital setting? Testing may be taken as per the discretion of the treating doctor, with one very important consideration, that no emergency procedure, including surgeries or deliveries, be delayed for lack of a test. And asymptomatic individuals undergoing surgical, non-surgical procedures, including pregnancy, in labor, who are hospitalized, should not be tested unless warranted, or they have some symptoms of sore throat, breathlessness, fever, headache, etc. And who may not be tested? And these are all asymptomatic individuals in community settings who are asymptomatic. All asymptomatic contacts of confirmed cases of COVID-19, unless they are high risk based on age or comorbidities, which I have already mentioned. And patients who stand discharged as per home isolation guidelines, and Sri Lavji has already talked about that, and patients being discharged from COVID-19 facility as per revised discharge policy, that is very clear. And individuals traveling from Delhi to Bombay, or Bombay to Chennai, or Chennai to Calcutta. So all domestic interstate travel do not require. But the last point, which is most important to remember, is home quarantine for all contacts for 7 days. So if I have come here for work, I go back home and I test positive, all my relatives who are above 60 or comorbidities should be tested. All my children, etc., should not be tested, but have to be in home quarantine for 7 days. Have to be in home quarantine for 7 days as per guidelines, and continue to wear masks. So use of mask is vitally important when you are doing home quarantine